there's been a quite rapid development on the vaccine development. So we wanted to provide some of the key updates, specifically with those 5 or 6 vaccines that are part of the national development effort. So starting with Moderna. Moderna applied with the FDA for an update with respect to their storage and handling, and this is a really positive change that the FDA has granted Moderna and updated their fact sheet as part of the emergency use authorization. And that those updates are specifically related to the handling of the vaccine. So previously, when you pull out as a provider Moderna's vial and you could leave it at room temperature for 12 hours, that time has now been extended to 24 hours. Now, that is before you puncture the vaccine vial. Once you puncture the vaccine vial and you're ready to just start administering the vaccine, the previous allowable time that you could keep it at room temperature was 6 hours, and that now has been doubled to 12 hours as well. So this allows greater flexibility, especially those sites that are vaccinating large number of individuals in a given day. This gives you added flexibility to keep the vaccine at room temperature either before or after puncturing. So that's a really positive change, and we hope that our providers will find it easier to administer that vaccine. Now, with respect to some of the vaccines that are still in development, so we'll start with Pfizer. As we know, Pfizer has the authorization for 16 years and older, but they have recently completed and released their data for the adolescent population, that is 12 to 15 years. The data was released last week. Very strong efficacy data for that population, 100% efficacy in that population versus the placebo control. So that's excellent news. So as part of the ongoing effort for Pfizer to expand that to that age population, they are now planning to file that with the FDA, and the FDA will do its due diligence, and we will see if that the age expansion will take place for Pfizer. Moving on to some of the vaccines that have not been authorized yet, and those are AstraZeneca and Novavax. So AstraZeneca has completed their phase 3 development already. They have released their interim analysis data, and the next phase for them is to file with the FDA. We've seen how the FDA has done the other 3 vaccines in terms of taking about a couple of weeks to review the data, meet with their advisors, and we'll see what the final verdict will be for AstraZeneca from the FDA perspective. The last one, part of the national effort development for the vaccine, is Novavax. Novavax has completed their phase 3 trial as well, but we have not seen any of their interim analysis data at this point, so we're eagerly awaiting to see how that data looks. And again, similarly to other manufacturers, they will also look to submit that data to the FDA and look forward to getting that authorization. And the tentative time is looking at either end of April or beginning of May. So those are some of the key updates we wanted to share with you. Thank you.
Thanks, Dr. Rai. Thanks, Commissioner Garcia. With that, we will open it up to questions. First one is from David Littman at KYTX in Tyler. East Texas, has a lower vaccination rate than the rest of the state. Is there anything to which you attribute that? And is the answer to send more doses so it's easier to get a shot, or to divert doses from other regions or rather to divert doses to other regions that show more interest?
So we have also noticed that data point for our East Texas areas. Now, we're trying to push more vaccines so that it's easily available within those jurisdictions and those providers in those areas. Now, at the end of the day, if we know that doses are sitting for a long time, we are talking with our providers about potentially moving them to other locations, typically close to the original provider, but in some cases, depending on what brand of vaccine it is, not everyone may be able to handle, say, Pfizer, and so we may have to move that vaccine further away. But we are wanting to do more and more messaging around vaccine hesitancy all across the state in order to help make sure that everyone is educated about the safety of the vaccine and making sure that it's easy to get a hold of.
Question next from Kayla Harris with Houston Chronicle. You previously mentioned that the state has seen declining demand for vaccines in some areas and have worked to transfer extra doses that you were just talking about. Where has this occurred? How many unused doses has the state had to transfer for this reason?
So I think we've recouped about over 50,000 doses moving from different providers, and quite frankly, it's been all across the state. I couldn't pinpoint a specific portion of the state that we've only moved from. So we've had some in the Valley, we've had some in North Texas, we've had some in the Panhandle, we've had some in Central Texas. We really see it in a variety of different areas, and are really working with the providers to make sure that we move it to folks who can use it quickly.
And would you say it's not necessarily those areas that are, seeing less demand, but those particular providers?
Yes.
Next question from William Joy at WFAA in Dallas. Most experts say the vaccination rate should be at least 75%. I think he's talking about sort of long-term down the road. Texas at this point far below that level, and demand is starting to drop. Does that concern you, and what's the state doing to combat that?
So when we saw demand dropping, it was before we opened up eligibility. And, I think we need to remember that we only opened up eligibility last week for the full age range that is eligible to receive the current vaccine. So I think the data is still coming in about what the true demand is that is out there. Obviously, from us going from 10 million doses to 13.3 million doses within a matter of 10 days, tells me that there is still quite a bit of demand, and that we have a great deal of our population that still wants it.
Next question is from Maggie Glenn with KXAN in Austin. How's the state doing as a whole in terms of total vaccinations, decreased hospitalizations, and decreased new cases? Is it too soon to be optimistic that we're almost through this?
So in public health, we are always going to watch the data and making sure that we're looking for possible trends in any specific direction. Our chief state epidemiologist, Dr. Jennifer Schubert, every morning goes over the data and kind of walks us through what the data is telling us. Now, at this point, we know that hospitalizations have been on a downward trend. We know that fatalities have been on a downward trend. And even when you look at that data by age groups, we continue to see good progress. Now, when we see things leveling off and maybe leveling out for a little while, that's where we start to get a little concerned and wanting to do more efforts in targeted areas. So I think it's too early for us to really be excited about a lot of things. But I think the bigger piece is that with the new eligibility opening up and the new ramp up that we see with this increased demand in the next within this past 2 weeks, we should be able to see even greater movement in the downward direction for the younger populations.
And that reminded me of a question that came in earlier from Avery Travis at KXAN, who asked, can DSHS talk through the allocation amounts for different counties and how the panel, the EVAT, makes those decisions? For example, why similarly sized counties would be receiving different amounts of vaccine?
Sure. So we go looking at providers all across the state, and we look at the county level allocations and county doses administered. But at the end of the day, from week to week to week, it's really based on what the provider can handle within that particular week. And in some weeks, we have some counties that the providers don't ask for any additional doses. And then the next week, they'll go back and ask for more. Now, I'm sure you guys have noticed that there have been some substantial shifts with this current week's allocations that are out in the field right now. Now, that is through that provider outreach that we have been doing and trying to make sure that people are burning through their doses. A lot of them have requested reduced amounts moving forward, and other ones just say we just need a week break in order to adjust as we make adjustments to our protocols now that we have a full open eligibility. So we look at it broadly. We try to keep the counties in range of less than 1% deviation from what their proportion of the population is. Now, that may wax and wane from week to week, depending on the provider demand in that particular area, but also what we know what is happening during that particular week. So if a county gets too far behind, in the next week, we may need to push more allocations to them in subsequent weeks. So that you're going to see the allocations fluctuate from week to week as those things occur on the ground, and that we're being sensitive to the provider's needs and to the data that we're seeing from those communities.
Question from Andrew Moore at KCEN in Temple. Kind of along those same lines, this is kind of specific to his area. He says, according to the allocation list, 2,500 doses of vaccine are going to the DSHS, PHR 7, office in Temple, Texas, which appears to be a DSHS office. That's exactly right. It got vaccine last week as well. How's the vaccine at local DSHS offices being distributed? He also notes that some local HEB pharmacies in Bell and McLennan County got 300 doses each last week. This week only got 100. Most of those locations stay booked. Will local pharmacies be getting a steady supply, or will that number continue to fluctuate? So you kind of spoke to some of that for the last question. And one thing to note is when you're looking at our allocations from week to week, that only includes the vaccine that actually flows through DSHS that we are actually allocating out to providers. That is separate from the federal pharmacy doses. So many of those HEB, CVS, and Walmart, and now also other Walgreens and other pharmacy chains are getting those allocations directly from the federal government. So those aren't showing up in our list. So those HEB locations or other HEB locations and similar kinds of chain pharmacies may also be getting doses through those federal programs. So that's just something else to keep in mind. And although I don't even talk more about sort of how the DSHS regions are distributing vaccine in their areas.
Sure. So we've had a couple of initiatives going on within our DSHS regions. And so one of the particular ones that has been out in the media is our partnership to help immunize the intellectual disabled group. And we have allocations going to the regions for Terrytown Pharmacy to help administer that particular population for us. We also have allocations going to the regions for the vendor teams that have been procured to be able to offer more and more clinics all across the state in those rural communities where our DSHS regions serve as the health authority.
And then, right, so, and then, of course, those regions are also doing vaccine clinics in some areas. And so some of that vaccine, going to Bell County, may be transferred for, to do clinics in surrounding areas. We've certainly seen that in some of the less populous areas that don't have as many vaccine providers, or none in some cases, that our regions are really stepping in to fill that role, working with local governments to make sure they can reach priority populations and then just the general population in those areas. So that's certainly some of that sort of core public health work that is ongoing with vaccination, trying to reach those underserved populations, just like with so many other public health programs. Ashley Lopez at KUT in Austin is wondering if there's any useful data to report yet from the vaccine scheduler. Has the system flagged any areas where significantly more people want vaccines than are available? I know at last check, we had about 150,000 people sign up in the scheduler. I don't know if we've, or Imelda, if you have in front of you any kind of more specific data than that.
No, I don't have any details on that, but we can definitely follow up with you on that.
Actually, that was one of Aparnazzolani's questions as well. Gina Sinceri with ABC News asked, how much of an issue are pharmacy deserts in Texas?
So we do have quite a few spots in the state that we have pharmacy deserts, or, quite frankly, just healthcare deserts. Now, we are working with the local county governments that are in those specific areas in order to help identify mobile teams that could be used to offer vaccine to those particular communities. And so we are keeping an eye on that. We are continuing to mobilize, as I mentioned, our vendor teams that can help fill some of those gaps, and we'll continue to expand that as well in the coming weeks.
Another question from Kayla Harris with the Houston Chronicle. You previously said that some vaccine providers have had difficulties with data entry, underrepresenting Texas vaccine numbers. By your estimation, how much have these delays impacted Texas daily reports, and how's the state working to address this issue?
So I can't tell you a specific number as far as how it has affected our daily reports. I know that through our provider outreach, we have some that it may be 1,000 doses that they are behind. We have some that are several thousand doses behind. Now, what we're doing to help them is that we are offering additional assistance and warm bodies to go on site to their locations and help enter that data in order to help get them caught up. Now, this is where, sometimes what we've heard is that as a result of the winter storm, they did get behind. They were more focused on administering doses and not necessarily on the data entry piece. And so they are still playing a little bit of catch up depending on, what provider we're talking about. So that is an active, ongoing part of our provider outreach, and we will continue to offer that assistance so long as any of our providers need it.
And a question from Aparnazzolani at CBS Dallas. Will fewer Johnson & Johnson vaccines coming in next week or with them, what impact will it have on programs like visiting nurse service or Meals on Wheels, which are administering those in particular to homebound seniors.
Yes, as the reduction in Johnson & Johnson does pose to have a significant impact on a lot of those mobile efforts that you mentioned. Now, with additional reductions looking ahead, I don't know yet what the true impact will be. We're going to have to be much more strategic and much more laser focused in where the limited Johnson & Johnson goes in order to make sure that those that are most vulnerable and can't get to other vaccine easily have access to the limited J&J that we will have.
Well, those are the end of the questions we have at the moment. Thank you once again for being with us today and participating, and for your attention. Really appreciate that, as we do during each one of these briefings. Thanks to Commissioner Garcia, to Dr. Rai for being with us today, and hope you all have a great rest of the week. Thanks so much.